Microminerals, part 3, chapter 14, page number 267. So first we will discuss about copper. Okay, copper is necessary in trace amounts for red blood cells building, collagen building, energy production, neuron signaling, immunity, and iron metabolism, as well as absorption. Okay, so it is a cofactor of several enzymes. Cofactor in the sense it helps in enzymes fulfilling their duty. Okay. For example, it has a specific role in the formation of melanin that gives color to your skin. Okay, it has a specific physiological role in making tyrosinase. Tyrosinase leads to the formation of melanin. Okay, and other oxide dismutase, etc., for taking down the free radicals. Okay, monoamine oxidase that helps in neurotransmission. So a list of enzymes in which copper metabolites are present, and they help in carry out this physiological duties have been listed on page number 267. Just go through that once, so you'll understand that what are the exact functions that copper do as being a cofactor for various enzymes to carry out their physiological functions. Okay, so apart from that, it helps in the production of RBCs, collagen, energy, neuron signaling, okay, immunity, as well as iron metabolism. So copper metalloenzymes, these are the ones which we have discussed just now. Tyrosinase, metalloenzymes is once the copper gets metabolized, okay, the byproducts of the metabolites, okay, they go and attach with the enzymes, okay, and they help in the enzymes fulfilling the physiological functions. Okay, so first is tyrosinase. It leads to the formation of melanin in your skin. Then we have cytochrome C oxidase. It is for the mitochondria to give out energy. Cytochrome C oxidase is required. These all are science-based answers. Okay. Then we have lysyl oxidase. It helps in cross-linking of collagen and elastin in supporting the connective tissue. It makes sure that the elastin fibers as well as the collagen fibers stay in a supportive state. They don't fall down. If the falling down of collagen and elastin in number as well as the shrinking of collagen and elastin will also lead to wrinkles. Okay, will also lead to aging process. So copper prevents that. Superoxide dismutase that helps in taking out the free radicals from your bloodstream, protects your living tissues. Monoamine oxidase, it helps in neurotransmission. Okay, it helps in the electric impulsive neurotransmission in the central nervous system. So these are the different functions that the copper metalloenzymes does in your body. Metalloenzymes are the metabolites of the copper which gets attached to the enzymes, and with the combination of this enzyme and copper metabolite, okay, physiological functions are carried out. Okay. Next, coming to the absorption. So with regards to copper, any part of your gastrointestinal tract can absorb copper, even your stomach. Okay, some part of copper can be absorbed from the stomach itself. Okay, and as well as the large intestine. Large intestine usually takes up your water and electrolytes from the food that comes to the large intestine, but copper is also being taken up by the large intestine. So most of the parts of your GI tract, all parts of your GI tract is able to absorb copper. Okay. Dietary intake may range from 2.5 to 5 mg per day based on your pulses and cereal intake. Okay. The source of coppers are the good source of copper. It's not that copper is not present in pulses, cereals, or other food. It is present in very trace amount. Okay, but the best source of copper are liver, starfish, nuts, and chocolate. Even in human beings, okay, too much of copper is stored in your liver. Too much of copper, if you have too much of copper in your diet, the excess will be stored in the human liver, and from that whenever the copper ions, they try to pile up. Okay, the excess copper ion will be discharged through the bile. Okay, through the bile into the GI tract, and from the feces it will be removed from your body. Okay, so excess copper and also the copper in general is stored in your liver. Okay, and once the copper reaches your small intestine, once the copper reaches the small intestine, it enters the small intestine, then the copper has to get attached to a protein complex. Otherwise, it will not be able to go into the bloodstream. In your bloodstream, copper, once it gets attached to a protein complex, it can either be hemocuprin, okay, that is found in the red blood cells, hemocuprin. Otherwise, it can be found in the plasma as well in the form of ceruloplasmin. Okay, on page number 267, the last paragraph, the first line, you will find these two words. Is it visible to all in the textbook? Page number 267, the last paragraph, first line. Please underline that. Copper protein complex. There are two complexes. Once the copper enters your small intestine, and from the small intestine, if the copper has to enter the blood stream into your blood circulation, it has to form a copper protein complex. Only then it can be carried into the blood circulation. So there are two kinds of complex that can form. One is hemocuprin in the RBCs, okay, and then in blood plasma, it will form ceruloplasmin. Is it visible to all? Is the information there in old and new textbook of all students? Even the students who have joined recently, who have got their books recently. Yeah, please underline that, okay? Those who are joining today for the first class, don't worry, continue with the previous batch students also, because now revision is going on. Exams are going to come in this month for previous batch students. So we are revising all the topics all over again, okay? So your chapters will also come along. So in the blood, copper with any protein complex will be transported to the liver, and there the copper is stored in the form of hepatocuprin. Okay, in the blood it is hemocuprin in the RBC specifically, and once it reaches the liver, it forms into hepatocuprin, and in the form of hepatocuprin, it is released back into the bile. Okay, it is released back into the bile, so that if there is too much of copper, okay, the body also wants to prevent any chance of toxicity. Okay, so in case of excess copper which is piling up in your body in the form of hepatocuprin, the copper will leave your liver through the bile into the digestive juices, and the small intestine already has the signal not to absorb excess copper. Small intestine will not absorb, large intestine will also not absorb, and it will be excreted through your feces. Okay, is the absorption clear to all? All parts of your intestine can absorb copper. Okay, for example, in your exam questions will come. Okay, is the following statement true or false? All parts of your GI tract can absorb copper. Okay, so such questions you can expect. Okay, if your concept is clear, you don't have to by heart this. Concept is clear, you can answer the question. Okay, is the absorption clear to all? Next, coming to copper deficiency. What is the name of copper deficiency? We have discussed that previously in one of the classes. In inborn errors of metabolism also we have discussed this. If you remember, previous batch students, not for new students, previous batch students. Kinky hair is a symptom. It's not the name of the disease. Yes, Menkes disorder. Menkes disorder, that is copper deficiency. And what is the toxicity name? And if copper is too much in your bloodstream, if the child has too much of copper in their bloodstream, what is the name? Yes, correct. Wilson's disease. Don't get confused, okay? Menkes is deficiency of copper. Wilson's disease is toxicity of copper, okay? So, kinky hair, which Anand had mentioned earlier, see that is the, you can see the photo here, image of the child. The same image is used in your textbook as well. You can see how coarse and brittle the hair seems here, okay? So that's the symptom. Kinky hair is the symptom, okay? It's not the name of the disease condition, okay? So sparse and kinky hair, sparse very less amount of hair, most of it just falls off, and kinky hair, okay, kinky hair, if you touch the if you pluck one single hair and run your fingers through the hair, feeling the texture of the hair, okay, when it is kinky hair, will you find a smooth texture, or will you find lots of zigzag in the hair? What you will find in a kinky hair? From the image, what can you imagine here? You can find the hair, which it is not curly. Kinky hair is not curly, okay? Kinky hair has a lot of zigzag in the hair texture. It's not smooth, okay? Loss of developmental milestones in childhood. For example, by 6 months, the child has to turn over its on its own over its belly and try to crawl, okay? By 8 months or 9 months, the child has to stand on its own by with support, okay? By 9 months and 10 months, the child has to start taking initial steps. If even if the child is not walking, at least initial steps of trying to walk. These all are developmental milestones, okay? Speech formation should be there, identifying the family members, okay? These are developmental milestones. So the child who is suffering from Menkes disease will lose all the developmental milestone. Even at the age of 2 or 3, the child may not be able to walk, okay? And why do you think that the developmental milestone is getting affected here? Because of the deficiency of copper. Which system in the body is getting affected because of the deficiency of copper? If you remember the function of the copper, the first slide, you will be able to answer this. Yes, the nervous system is underdeveloped. Okay, nervous system is underdeveloped. Because for the health of your nervous system, copper is required, and when the copper is deficient, the nervous system will be underdeveloped. So all these developmental milestones will not be reached at time. Okay. Then we have truncal hypotonia. People from the medical background, what do you mean by hypotonia? Hypotonia. From the name itself, it is quite clear. Hypotonia. Muscles become flaccid. Okay, muscles become flaccid. There is a tone to the muscles. Okay, there's a tone to your muscles. Okay, that becomes flaccid. That is truncal hypotonia. Okay, decreased in muscle tone and muscles become flaccid. The body is very flaccid, very loose. Okay, there is no strength in the body. Okay, failure to thrive. What do you mean by thrive? People from the medical background and those who are from the commerce background, please note the chat box as well. Pediatricians, those who are studying pediatric nutrition as well. What do you mean by thrive? In pediatrics. See, that thrive has the other meaning of survival, etc. But in pediatrics, we have a different meaning to thrive. Yes, it is growth. Growth based on the developmental milestones. Okay, that is thrive. Okay. Otherwise, whenever you're using thrive in a statement, that is to survive, to overcome. Okay, that is all the grammatical meaning to the word thrive. Okay, but when we are using the word in pediatrics, it is to grow. Okay, growth achieved. Okay, so the failure to thrive means the child will not grow properly. Epilepsy is your fits, convulsions, seizures. Okay, And in laboratory test, when you do serum test, blood plasma test, okay, low serum copper will be there, and low ceruloplasmin. Ceruloplasmin, as we know, is the copper protein complex, okay, because copper as an ion, it cannot travel in the blood circulation. It has to attach itself to a protein complex to go through the blood circulation, okay. Treatment: copper chloride tablets can be given, L-histidine injections can be given. Okay, that is the treatment. You cannot prescribe anything until and unless you have a medical degree, until and unless you have MBBS degree, you are not supposed to prescribe any drugs. Okay, that this part will be taken care of by the pediatrician. Next, coming to copper poisoning or copper toxicity, and these are the symptoms which you see: systemic chills, fever, pain. Okay. Supplements you can prescribe, okay, but like the over-the-counter supplements you can prescribe, but not the other ones, okay, like copper chloride, etc. These are prescription level, okay, these are prescription level supplements that you are not supposed to prescribe. Yellowing of the skin and eyes because copper toxicity, the first organ which will take the hit of copper toxicity will be your liver, because the copper is stored in your liver. Okay, the toxicity signs and symptoms will first hit your liver, so definitely you can expect jaundice. Okay, anemia, shock, metallic taste in the mouth, convulsions, epilepsy. Okay, rashes and weakness, vomiting, nausea, abdominal pain, burning sensation, decreased function of the liver, because a person who has been affected by jaundice, liver functions will be decreased. No urine production in the kidneys, intestinal diarrhea, okay, maybe bloody or bluish feces will be excreted. So that is what we call as Wilson's disease when there is copper toxicity. It is Wilson's disease. Usually, if either you are having too much of diet that is rich in copper, or your GI intestine, it is absorbing a lot of copper. Okay, in deficiency also, even if you are having a good diet which has adequate amount of copper, but because of malnutrition or because of any other absorption based disorders like diarrhea, etc., the child's body may not absorb enough amount of copper. That may also lead to deficiency. Okay, and in some certain cases, whenever there's a genetic defect, that can also lead to Wilson's disease. So all the copper is supposed to be like the 90% of copper that you have in your diet is completely absorbed by the body. Okay, and it is not excreted properly from the body, that leads to Wilson's disease. In Wilson's disease, you can also check the eyes of the child or the person who has been affected. You will find a brownish ring around the iris of the child's eye. Okay, that is also a symptom of Wilson's disease. Next, coming to the recommended daily allowance of copper. So all these food sources are good sources of copper. Okay, copper is available in more than beyond these list which I have shown. Okay, copper is available in most of the fruits and vegetables that grow on the soil, because soil naturally has a copper content to it. Okay, but the list which we are showing here, it is one of the good and the best sources of copper. Okay, so RD of copper is 2 mg per day. Okay, very less amount you require. Mushrooms, almonds, quinoa, cashews, all your lentils, which we usually use in Indian cuisine, chia seeds, sesame seeds, raisins, avocados. In animal sources, you have oysters, shellfish, and animal liver. Okay, these all are good sources of copper. So you can take a screenshot of this. See, for neutropenia, you have to understand what is neutrophils. What is neutrophils? Students who are from medical background, what is neutrophils? What kind of blood cells are neutrophils? It is a type of WBC. Okay, that is white blood cells. Okay, when there is too less amount of this specific WBC, that is neutrophil, that leads to neutropenia. So neutrophil is a type of white blood cell. Okay, when it is fewer than normal in your blood circulation, that leads to neutropenia. Next, coming to fluorine. Fluorine occurs naturally as a negatively charged ion, that is fluoride. The symbol we use is F minus. And about 95% of the total body's fluorine is found in your bones and teeth. Okay, so functions of fluoride, everyone knows about it. It gives a good oral health. Okay, it hardens your teeth's enamel while you are growing up. Okay, especially you have to focus on the fluoride intake for children. Okay, otherwise they may have to suffer with dental caries throughout their life. Okay, protects our teeth from dental caries and stabilizes the structure of our bones. These are the main functions of fluorine. And in childhood, if the child has been deficient in fluorine, even when the child turns into adult, the child will still suffer from a lot of dental caries or tooth decay. Okay. So even in therapeutic use, whenever it is prescribed, fluorine is usually recommended for preventing dental caries, tooth decay, and also any osteoporotic fractures that happen in women post the age of 35. Next, coming to the absorption and excretion of fluorine, intake of fluorine, which is the good source of fluorine? Any guesses? Good. The main source of fluorine should be drinking water, that is groundwater. Okay. Water is supposed to be the best source of fluorine that should suffice your RDA, daily recommended allowance. Okay, it should be taken care by your water. Okay. So intake of fluorine, it goes into your GI tract, and from the GI tract it is absorbed, and it goes into the blood plasma through the intestine. It will enter the blood plasma, and from plasma most of the fluorine will go to the calcified tissues. Calcified tissues are your bones, teeth, etc., some part of cartilage as well, and only some soft tissues excess fluorine will go and settle down in just to retain it. Okay, so in case of deficiency from the soft tissues, it like liver, etc., from the soft tissues it will be taken up for calcifying the bones and other calcified tissues. Okay, excretion through saliva, through your feces, sweat, and urine. And whatever fluorine is excreted from the saliva, because saliva also has fluorine content to it, it can again get absorbed by the GI tract. Okay. So that's about your fluorine absorption and excretion. It's very easy. The most of the absorption of fluorine takes place in your small intestine. Okay. Through passive diffusion, it can also your mouth can also absorb fluorine. Okay, some part of stomach, but most of the absorption will be taken care of by your small intestine. Is it clear about fluorine absorption? Part 3 of microminerals. Today's topic, part 3 of microminerals. Fluorine absorption and metabolism is relatively very easy. Okay, most of the parts of your GI system can absorb fluorine, but majority of the absorption takes place by your small intestine. Through passive diffusion, directly the fluorine ions can be diffused directly into the skin of your mouth as well. That's why saliva also has fluorine content to it. Yes. Fluoride is absorbed by all parts of your in the intestine, gastrointestinal tract through passive diffusion. So RDA, we had like every 1 liter of drinking water should have at least 1.5 mg of fluoride. Get your groundwater checked for this. If you are drinking borewell water or groundwater water, please get it checked. Otherwise, if you live in certain areas of southern parts of India, like in certain districts like Andhra Pradesh, Prakasham district, okay, in if you are from Tamil Nadu, the districts of Vellore, Dharmapuri, Krishnagiri, Salem, Erode. Okay, these districts naturally have high fluorine content in their groundwater. Okay, so if you are using borewell water for drinking purposes, even you are using filtered water, please check get your groundwater checked. Okay, on the fluorine levels. Otherwise, it may lead to fluorine toxicity. Okay. No, boiling water will not destroy fluorine. It's an ion. Okay, it's not a bacteria or any organism which will be affected by heating the water. Okay, if you want to remove the excess fluorine content to it, in India, in the state of Andhra Pradesh, they have added lime to the borewell water. Okay, it will be stored and allow the lime to get reacted with the fluoride. Okay, and the top water will be used for drinking purposes. So this kind of initiative was taken in some states of Andhra Pradesh. Okay, so yeah, boiling water will not destroy fluorine. Okay, fluorine content of the water is usually not destroyed, but chemically uh, you can transfer it into a solidified state of fluorine, which will settle down. Okay, which will settle down along with the lime, and then the topmost part of the water you can use for consumption. Okay, in some villages which naturally has high groundwater levels of fluorine, government has set up these initiatives. Okay, we'll discuss that later. So toothpaste, nowadays you can check any toothpaste. Even in their advertisements, they claim about using clove oil, using fluorine in it, additionally enhanced with fluoride, etc. Okay, so toothpaste is a good source, and especially for teeth, fluorine requirement for teeth, toothpaste is a good source, but not for consumption. Okay, fluoridated water supplies, fluorine supplements. Okay, and food processed with fluoridated water, like when you're buying distillery water or Kinley water from outside. Okay, they are additionally fluorinated. Mouthwashes also has fluorine content to it. Okay, so apart from drinking water, these are the other sources which can amplify your fluorine requirement. Some kids who you must have noticed this in most of the children. Okay, not all, but in most of the children, if you have come across, they try to eat toothpaste. And even in certain pregnant women, you will see this case. They try to eat toothpaste. Have you come across these cases while dealing with kids? So try to check the child's fluorine requirement. Okay, is the child having drinking water properly? Usually the child or the woman may be they may be deficient. In most of the cases, they may be deficient in fluoride. Okay, or the water that they are usually consuming is deficient in fluoride, and that's the reason why they have this pica. Okay, I have mentioned the spelling of pica in the chat box. And what do you mean by pica? Previous batch students who are preparing for exam, what do you mean by pica? It's the urge to eat food that is usually not edible. Okay, like some people have the urge to eat mud, chalk, okay, slate boards. Some people like to just by the smell of petrol or kerosene, they feel like they want to drink it. Okay, so this is called pica. So having the urge to eat or taste toothpaste. Okay, that also comes under pica. And usually when it happens usually in most of the subjects who are deficient in fluorine. Okay, in most of the mineral deficiencies you will see this kind of pica rising in people. Okay, so this is the fluorosis. Fluorosis is the toxicity of fluorine. We call it fluorosis. Okay, so these are the states of India which has recorded high levels of fluorosis. Okay, the groundwater level in these states, which is in bright red color. Okay, the groundwaters in these states which are in bright red color, they have naturally higher fluorine content to it. Okay, and this report is from the year 99, from the year 99. So fluorosis leads to this kind of musculoskeletal disorder. One is genu valgum, that is knock knee, and genu varum, that is bowel act. Okay, you can see how the knees are. Okay, if the knees can touch each other, when the knees can touch each other, it is valgum. And when the knees are not able to touch each other, when the calves of the legs are forming a arch like structure, when they are not able to touch each other, okay, that is bowel legged. Okay, when the knees are able to touch each other, the ankles will not touch, that is valgum. Okay, here the knees are not able to touch each other, but the ankles will touch each other, so that is bowel legged. Is it clear? Genu valgum and genu varum. So this is skeletal fluorosis. This is skeletal fluorosis. Okay, it's very slow. It takes years and years of fluorosis. The patient is suffering from fluorosis from pretty long time. It will not happen overnight or within a month or so. It takes years to come up to this level. Okay, see, if you just focus on the image of valgum here, okay, call it just valgum, no need to call it genu valgum. Okay, even if you call it valgum and varum, it is right. Okay, so in case of this image here, valgum, you can see here that it is knock knees. Knock knees means knees are able to knock each other, touch each other, knock knees. Okay, but if you look at the ankles here, the child's ankle, it's far away. The ankles will, even if the child stands straight, okay, the ankle will not be able to touch each other. Okay, so that is valgum. That is the case of valgum. And this is bowel leg, that is genu varum or varum. Okay, which disease condition you can see this bowel leg, in which the other deficiency? Previous batch students, you can answer the chat box. In which other deficiency you can see this bowel leg? Yes, vitamin D deficiency, and that is called rickets. Okay, rickets will happen only in children. Okay, rickets will happen only in children because of vitamin D deficiency. If a vitamin D deficiency is still prevalent in adults, it leads to osteomalacia. Okay, no, for skeletal fluorosis, only valgum will take place. Okay, and mostly it is valgum. Genu varum can also manifest, but it is very rare. You will require physiotherapy here. Okay, you will require physiotherapy here. Any physiotherapist here can answer. You use certain appliances. Okay, certain appliances are applied on the knees as well as the calf. If we have any physiotherapist in our participants, they can answer what kind of treatment do you suggest here. Physiotherapy and an orthopedician is required to treat this condition. And in certain severe cases, surgery may also be required. But in mild cases, some appliances are like if you have seen a child with a polio leg, okay, very similar appliances are used for treating valgum. In severe cases of valgum, surgery is recommended. On page number 272, you can see the image of different kids who have been affected with different stages of valgum. Okay, kids affected with varum as well as valgum has been mentioned on page number 272, those who have the textbook. And if the fluorosis is not treated, if the fluorosis continues, the child may cripple. Okay, it may lead to crippling fluorosis. Crippling fluorosis means the child will not even able to walk on its own. Okay, the child will require support. So if the fluorosis is not treated, it will lead to crippling. Okay. And if you see the teeth here, mild fluorosis, some white patches, moderate, and in severe fluorosis, you can see the teeth has lost its natural shine. It has become completely mattified. Okay. And it is chalky in structure. Okay. That is because of fluorosis. This is dental fluorosis. The one you see here, valgum and varum, that is skeletal fluorosis. And on the right side, all the four images, they are called dental fluorosis. So the enamel here loses its shine, luster. Okay, it becomes rough, mattified, chalky in look. Okay, it is as white as a white chalk. Okay. And if it reaches these this stage of severe dental fluorosis, it is irreversible. It cannot be reversed. So next, coming to effects of fluorine toxicity, acute effects and chronic. Okay, acute effects: nausea, vomiting, hypocalcemia. For example, if somebody grew up in a state where the fluorine content was moderate, mild to moderate, okay, it is not affecting you with fluorosis, but suddenly you move, you got transferred, or you move to these fluorosis affected states or districts in India. Okay, so you will face acute effects. Okay, you will not face chronic effects. Okay, immediately when you start drinking water which is highly which has high amount of fluorine, acute effects is the one the person will be facing. But the people who are native to those areas affected by fluorosis, okay, they will have chronic effects. So in acute effects, you will see nausea, vomiting, hypocalcemia, tetany, especially of hands and feet. What is tetany? It's just the opposite of hypotonia. What do you mean by tetany? Students who are from the medical background. Tetany is not cramp. Yeah, it is rigidity. Okay. Involuntarily, your muscle will become rigid intermittently. It becomes rigid, and after some time it will soften up. But again, without your knowledge, without you doing anything, it will involuntarily become rigid. Okay. So that is tetany, especially on the hands and feet. Hypotension, decreased blood pressure, hypersalivation, too much of production of saliva. Okay. Mixed metabolic and respiratory acidosis due to the failure of renal and respiratory system. You can feel something that is acidic in your mouth, in taste, or even in your breath. Okay. Coma and convulsions that may lead to death. That is in severe cases. Okay. Chronic effects: dental fluorosis, skeletal fluorosis, hypersensitivity reaction, dyspepsia. Dyspepsia means not able to digest. Okay, not able to digest properly, digestion issues, that is dyspepsia. Gastric irritation, insufficiency of the renal system, that is kidneys are not functioning properly. Numbness, paresthesia may affect especially the tips of the finger, the tips of the toes. Okay, they will start losing their touch sensitivity. Okay, numbness will start from there, paresthesia, etc. Muscle spasm, birth defects, cancer. Okay. Boiling water will not reduce fluorine content. Okay, there are other measures for reducing the fluorine content. So this is the Nalgonda technique. Nalgonda is a place in Andhra Pradesh, okay, and where a lot of kids suffered from severe skeletal as well as dental fluorosis. Okay, if possible, you can just take your Google right now. Okay, right now, please take the Google and search about Nalgonda kids. With fluorosis. Nalgonda fluorosis. Just search about this. Go to the image. Go to the image of the Google image. Now Nalgonda is in Telangana, but now when this technique was available, when it was discovered, this technique, it was Andhra Pradesh. Now it is in Telangana. Is the images clear to all in your own personal devices? Are you able to see the crippling that has taken place in this village? And specifically the dental fluorosis, the whiteness, the chalky white teeth that is very prevalent in this part of the country. So this was seen, this case was seen in most of the kids who are born here. Okay, almost all the kids who are born here, they did end up with some or the other crippling because of valgum and varum, genuvalgum and genuvarum. Okay, progressive crippling and chalky teeth. Okay, and when researchers came and did their extensive research here, and they identified the cause, that was the groundwater of Nalgonda was terribly high in fluorine. Okay, so the Nalgonda technique was implemented here. Okay, so they have to take lime and alum. What do you call alum in your regional language? I'm not sure what you call alum in Hindi, but it is readily available in any of the kirana stores wherever you go. Okay, a fitkari, patika, in whatever in your regional language you call alum. I'm not sure. South Indians can also join in. Okay, so alum and lime will be added into the water and the sediments will form, and you will allow the sediments to settle. Okay, and you can see here equal amounts of alum and lime has been added into the raw water that you have took from the bore well. Okay, and you have to mix it vigorously so that all the fluorine content in the water will react with the alum and lime, and the sediments will deposit down. Okay, this creates a toxic sludge that has to be disposed properly. The toxic sludge is the one you can see here in the raw water bin. Okay, a sludge has been formed. Okay, that is the excessive fluorine that has settled down after reacting with the alum and lime. Okay, and the remaining water you can filter it out, use a filter and cloth, because the sludge should not enter the human body. Okay, so filter properly the using a cloth filter and use the water for consumption. Okay, it is potable water now. So yeah, even in regional languages, students have added what do you mean, what does it mean by alum. Okay, so this is the Nalgonda technique. This technique is used in all the overhead water tanks of the village of Nalgonda. Okay, and even the main water tank which they have in, or even the municipal water tanks which they have in the village of Nalgonda, they all use this technique. It at every household level, the Nalgonda technique has been implemented. So not just in India, it was developed in India in Nalgonda, and even in the country of Tanzania, where people face the same fluorosis issue, it has been implemented there, and it has been successfully running till now. Okay, so this is the Nalgonda technique which we use to defluorinate the water. Okay, is it clear how to incorporate the Nalgonda technique? So the government of India has this national program for prevention and control of fluorosis, established in the year 2008 and 2009, and now it is under the National Rural Health Mission. Okay, since 2013 we have the National Rural Health Mission. So National Rural Health Mission takes care of this national program. Okay, so this program has various roles in the community. It has to take care of the surveillance every case of dental fluorosis, and every case of no, RO purifier will not be as good as removing excessive fluorine. Okay, so yeah, surveillance of each and every case of skeletal fluorosis and dental fluorosis has to be notified to the government. Okay, that is surveillance. Training and manpower support using the community health nurses, community health doctors. Okay, they will be trained to teach this Nalgonda technique to the natives in the native language. Okay, establishment of laboratories and diagnostic facilities to regularly check the, not just the human subjects here, but also regularly check the levels of fluorine in the groundwater used by the natives there. Okay, treatment as well as health education is given to the community as a whole, not just patients, community as a whole. So these all are the functions of National Health Program for the prevention and control of fluorosis. ICMR also has a task force to control fluorosis. So is it clear about fluorosis and what all recommendations are there to prevent fluorosis? Also giving the patients who have been affected with fluorosis vitamin C supplements. Okay, supplementation of vitamin C is also seen to elevate the symptoms of endemic fluorosis. Endemic fluorosis means in a small village, okay, in a small area or a town, this disease is very prevalent. Okay, so that's an endemic disease. Okay, disease that is common to an area, that is endemic. Okay, so vitamin C supplementation to all the population who is living in that area has known to remove the symptoms, some symptoms of fluorosis. Vitamin C supplementation will not cure fluorosis. Please don't misunderstand that. Vitamin C supplementation will not cure fluorosis. It will just elevate certain symptoms. Okay, like numbness, toxicity, symptoms like vomiting, diarrhea, dyspepsia. Okay, these things will be elevated with the help of vitamin C. It will not cure fluorosis. So is it clear about fluorine this far? So far, whatever we have discussed about fluorine, fluorosis, and the treatment, Nalgonda technique. Next, coming to zinc. So zinc has various functions. It's also a mineral that helps with your immune system. Okay, supports your healthy growth and development, supports your immune system. It helps your nerves to carry messages between that is neurotransmission. Okay, just very similar to copper. Zinc also helps in neurotransmission, helps to form your genetic material DNA, and it regulates the gene expression. So the deficiency of zinc can lead to some amount of mutations as well. Okay, supports the reproduction, helps in the bodies to build protein. So zinc has a vast majority of functions that it has to do as a mineral in human body. So next, coming to the absorption of zinc directly through passive diffusion, the zinc will be absorbed into the intestine. This is an enterocyte, the ones which you can see here, the villi of the intestine, enterocyte. So the zinc is directly from the dietary zinc. It is directly absorbed by the villi. Okay, and it enters your plasma, and from the blood, it reaches your pancreas, your liver, bones, kidneys. In men, it also goes to your testes. Okay, for semen production, for spermatogenesis. Okay, through the kidneys, it will access the zinc will be excreted out of your body. Okay, through the skin also access zinc will be excreted out. And for the heart, for heart palpitation, muscle contraction, zinc is required. So this is how the zinc directly through passive diffusion, it can enter your small intestine. It is not complex. It is not a complex mineral to be absorbed. Amino acids and peptides in your diet, that is protein-rich diet, increases the absorption of zinc. And the bioavailability of zinc from human milk is high, means the amount of zinc that is available in the breast milk, okay, for the infants, that is readily absorbed by the child's intestine. That bioavailability means even though the food is a rich source of a particular nutrient, but is that properly absorbed? The richness of that nutrient, is it completely and properly absorbed by the human body? That is bioavailability. So the bioavailability of zinc in human milk is considered the highest, because the breast milk rich in zinc is completely and readily absorbed by the infant's intestine. So now coming to the very important function of zinc, that is in human immunity. Okay, zinc as a gatekeeper of immune function. So zinc deficiency, overproduction of inflammatory cytokines. What do you mean by cytokines, people from the medical background? When are the cytokines released? Cytokines released? Yes, whenever there's an inflammation or infection in the body, not just inflammation. Okay. And cytokines are also responsible for the growth and development of other immune cells like lymphocytes and blood cells, WBC. Okay. In response to inflammation, they are released, but also they are responsible for making new WBCs in your body. Okay, as well as lymphocytes in your body. Okay, and it leads to thymus atrophy. Thymus gland produces what in reference to your immunity? What is produced by thymus gland in response to your immunity? T lymphocytes. T lymphocytes means thymus lymphocytes. Okay, so if the thymus gland undergoes atrophy during childhood, because thymus gland is active specifically when you are a child. Okay, so thymus atrophy means thymus gland reduces in size. Okay, so when a gland reduces in size, its functions will also be impaired. So there will be very less T lymphocytes produced in the child's body. Okay, so there will be T lymphocyte disbalance. And B cells. What do you mean by B cells? From where is the B cells produced? Students who are from the medical background, only they can answer this. Commerce students can benefit from the answers. Okay. Yes, the bone marrow produces B lymphocytes. Okay, so in zinc deficiency, already the thymus gland is reducing in its size, so there will be no enough T lymphocytes in the circulation. Also, less B lymphocytes will be produced. Okay, so basically your immunity is falling down and down. Okay, see, cytokines will be overproduced because the cytokines wants to indulge in more production of T lymphocytes, B lymphocytes, and WBC. It's just a reaction of cytokines towards zinc deficiency. Okay, your body will go into an inflammatory state when you're deficient in zinc. Okay, zinc homeostasis means you have a good amount of zinc, whatever is required based on your age group, based on your gender, whatever, and whatever amount of zinc is required, you have that in your body, in your diet. Okay, so you have a balanced immune cell number and function. So that is a balance between your tolerance as well as your defense mechanism. You are healthy, your body is apt enough to fight off infections. So that is zinc homeostasis. Okay. No, B is not beta cell. B cell means it comes from bone marrow. Okay, B lymphocytes that comes from bone marrow. T cells means T lymphocytes that come from thymus gland. And when there is zinc toxicity, okay, zinc is an axis, suppression of T and B cell function will be the symptom here. And overload of T cells will be there. Direct activation of macrophages. Macrophages are the ones that engulf your bacteria, that swallow up the bacteria or any foreign body that is causing any infection. Okay, those are called macrophages. Okay, so macrophages will be increased in your blood circulation. So that's how zinc has a very important role in human immunity. Okay. Next, coming to zinc deficiency. So these are the symptoms that you can see as a part of zinc deficiency. Spots on fingernails, which is very common. Okay, a common sign: spots on fingernails, low energy, insomnia, loss of sleep. Okay, not able to sleep, infertility in men usually. Okay, loss of taste and or smell, skin rashes or eczema, and even to combat certain acne issues. Okay, zinc tablets are recommended. Okay, loss of appetite, lowered immunity, poor memory, sinus problems or allergies. Why sinus problems or allergy? Because in case of deficiency, the body is already in an inflammatory state. Okay, and too much of cytokines will do what? Anyone from the medical background, can you guess the answer? When too much of cytokines are being released, what happens to the body? No, not recurrent infection. In terms of allergy, yes, exaggerated immune response, even for simple things that the body is not supposed to react. Okay, the body is not supposed to react to dust, the body is not supposed to react to pollen. Okay, these are not harmful things for your body, but the body overreacts. That's how you get allergies. Why? There is too much of cytokines and histamines in your system, that is overly sensitive. Your body is overly sensitized because of too much of cytokines that has been pushed out into your system. Okay, so now the overly sensitive body will react to anything and everything. That's your allergy. That's basically your allergy. Okay, and with allergy comes your sinus problem, sinusitis, etc. Okay, breast or prostate cancer, that is a far stretch. It doesn't happen acutely. That is chronic zinc deficiency could lead to cancers. Loss of libido, sex drive. Okay, frequent colds and flus, abnormal hair loss, slow thinking process. Okay, so these are the zinc deficiency symptoms. On skin, you can see usually the most commonly over the counter, this tablet is sold that is called Zincovit. Okay, is it, have you heard about this Zincovit? Usually when you suffer from any of the acne related issues, skin problems, skin rashes, blemishes, okay, zinc tablets are usually prescribed. Yeah, especially when you're suffering from too much of hair loss along with skin issues. Okay, this kind of Zincovit kind of tablets or their other variants are prescribed. Okay. Zinc is also essential to convert your beta carotene into vitamin A. Beta carotene is like, from which source do you get beta carotene? Which source? Previous past students who are preparing. It's plant source. Okay. Not just, or not, it's not always carrots. Just because it has the name called carotene doesn't mean it's from carrots. Okay. Beta carotene is present in all your yellow, orange fruits and vegetables. And most of your green leafy vegetables also has beta carotene. So it's basically your plant source. Animal sources will not have beta carotene. Okay, animal sources will directly give you vitamin A as it is. Okay, plant sources will give you beta carotene, which has to be converted into vitamin A, which can be further stored in your body. Okay, so zinc is essential for that conversion. Okay, so zinc in human plays an important role of cell-mediated immunity, and it is also an antioxidant and an anti-inflammatory agent that we have seen earlier. Zinc is an anti-inflammatory agent. It reduces your enough amount of zinc will take your body away from the inflammatory response that the body is already in. Okay, and it also plays a part as an antioxidant. It reduces your free radical stress. Now coming to the zinc toxicity, all the toxicity will definitely have nausea and vomiting, diarrhea. Okay, because the body is in a state of expelling the diet. Okay, the body is in a state of expelling the diet as much as possible, from all the orifices of your body. Excessive sweating, excessive vomiting, diarrhea, too much of urination. You will see all these kind of symptoms with toxicity. Okay, epigastric pain, because the gastrointestinal system is under is affected. Okay, abdominal cramps, altered blood lipid levels, that is too much of LDL and reduced HDL, low density hypoprotein and reduced high density lipoprotein, which leads to cholesterol issues. Copper deficiency, too much of zinc will not allow copper to be absorbed by the body, because zinc and copper has a conflicting absorption. Okay, if there is too much of copper, if you have copper toxicity, you will have zinc deficiency. Okay, zinc toxicity will lead to copper deficiency. Anemia, altered immune response, decreased lymphocyte stimulation, decreased chemotaxis, decreased phagocytosis. These all are medical terminologies. Common students don't worry about it. In detail, such questions will not come. Okay, just understand what is zinc toxicity, what are the clinical symptoms of zinc toxicity. That's it. Now coming to RDA, which is on table 14.1. See, balancing out copper and zinc, it is all abundantly present in your diet. Okay, zinc is very tricky to be absorbed in certain cases. If your body is in an inflammatory state and all, zinc absorption is not qualified well. Okay, so copper, you do not have to worry about copper supplementation. Okay, copper, you just require 2 mg of copper per day. Okay, usually most of the people in most of the age groups, men, women, etc., they require just 2 mg of copper per day, which is given by your cereals, pulses, fruits, vegetables, etc. Okay. Zinc also in a very similar way is found in your mushrooms, legumes, whole grains, Okay, in animal products it is there, in your shellfish, okay, poultry meat, organ meat, okay, they all have zinc as a natural source. So you do not have to worry much if your diet is a balanced diet, you are having enough amount of copper and zinc. But if your body is is in an inflammatory response, okay, you have lots of allergies going on, okay, so, and also in certain cases sudden allergies, you haven't faced this kind of allergy before, but today you are facing this allergic reaction, that could also be a symptom of zinc deficiency. Okay. See, drinking water from copper vessel, do not drink more than 500 ml of water from copper vessel per day. Okay. Nowadays, you do have this 1 liter bottles for storing copper water. Please do not do that. That leads to copper toxicity. Okay. Cooking all the food in copper vessels, drinking water only from copper vessels, this all will lead to some sort of toxicity, especially copper toxicity, and it will diminish other minerals availability. Okay, so please don't do that. If you want to drink water from copper vessel, just make sure you are not drinking more than 500 ml of water which is stored in copper vessel. Okay, you can store it overnight, less than 500 ml of water, store overnight, drink it in the morning. Okay, and some people will also face this. As soon as you drink that copper water first thing in the morning, you feel nausea or vomiting. Okay, has anyone felt that? Because personally I did feel that when I tried it, so I have to stop it, because what it means that you already have enough copper in your body. You do not have to overdo it with copper vessels or water stored in copper vessels. Okay, because personally I did have that experience of nausea and vomiting as soon as I drank the copper water which was stored. Okay, so that was the body's way of saying that you do not require this. You are already having enough amount of copper through diet. Okay. It was not much because of the smell. It's because of the taste and how it reacts once it enters the stomach. Okay. So be very careful while using the copper vessels. Okay, don't cook every day on cook in copper vessels. Okay. For infants and newborns, the zinc is available through the mother's breast milk. So the breast milk is a good supplement of zinc as well as copper, etc. Okay, all the minerals, the mother's breast milk has a good taste. It is not like only pollen and allergy. Okay, it's very subjective. Allergies are very subjective. It could be any allergy, and usually sudden allergies. Okay, sudden allergies could also be related to zinc deficiency. Once you start taking zinc tablets or zinc supplements, you can see you are not allergic to the previous cases, or you are not allergic as often as your previous times. Next, coming to chromium. So chromium content in the adult body is around 6 mg. Okay, and it is present in all organic matter, and it is an essential nutrient as well. Okay, so this mineral is involved in your metabolism. It improves your insulin efficiency as well as energy efficiency. It improves those who are diabetic, if they have enough amount of chromium in their diet, it is improved it shows a good insulin response in diabetic people. Okay, and sports performance we cannot be sure of. Okay, it's not like that taking too much of chromium will enhance your sports performance. Okay, we do not have enough research on that. It's just enhances your energy levels. That's it. Okay. In whole grains, legumes, apple, brewer's yeast, etc. Okay, these all are good sources of chromium. Okay, usually you have to focus on the chromium's efficacy in insulin response in diabetes. Okay, and also in metabolism. So those who are looking for weight loss, etc., without losing your lean muscle mass, okay, if you are looking for fat metabolism and carbohydrate metabolism, chromium is a good chromium rich food. Indulging in chromium rich food. Don't go for supplementation blindly and don't end up with toxicity. Okay, indulge in chromium rich food. And also kids who have protein allergy, malnutrition, okay, their glucose tolerance have also been seen to be improved with chromium. Okay, once chromium supplements are given, the child is able to keep carbohydrate in their stomach. They are not showing toxicity signs like nausea and vomiting. Okay, because once a child is when you're treating a child with protein allergy malnutrition, you have to indulge in a lot of glucose or carbohydrate rich food. Okay, because it is not just protein, but it's also energy malnutrition. Okay, so glucose intravenously and carbohydrate rich food orally is given to these kids, but usually they will not tolerate glucose well. Okay, when they are recovering from PEM, they do not tolerate glucose well. In such cases, chromium supplements under the prescription of a pediatrician has shown to improve the condition. So in athletes, it has shown, only few studies have shown, please don't depend on this statement. Okay, only few studies have shown. Please read that statement again and again, the third paragraph on to page number 281. Some studies have suggested. Okay, it has only suggested. It has not concluded. Okay, because these kind of informations can lead to people overindulging and leading to certain criteria of toxicity. Okay, so it has shown to enhance the muscle development, reduce fat, but also keep the energy high. Okay. Next, coming to selenium. RDA is 40 micrograms per day. It boosts your immune system. It prevents Cashing-back disease, and it prevents cancer and heart diseases as well. So it doesn't cures, but it just prevents, protects against fungal and microbial infections. It helps to regulate the thyroid production of thyroid hormone, people who are suffering from thyroidism, hyperthyroidism. Aids in reducing hair loss and preventing dandruff. Gives relief from rheumatoid arthritis, gout, and eczema. It is just a generalized statement about the functions that selenium has. Okay, but basically selenium, you do not have to overdo it. Just make sure you are not deficient in selenium. Okay, so Cashing-back disease, it's kind of a arthritis, joint arthritis. Okay, Cashing-back disease, it's a form of arthritis. So that's how it helps to prevent Cashing-back disease. It does not cure. Okay, it just prevents the prevalence of these diseases. Do not have lemon water or anything acidic first thing in the morning. Okay, you can definitely take lemon water later, but do not have lemon water or anything acidic first thing in the morning. Okay, it will lead to, over a period of time, it will lead to peptic ulcers. Okay, because when the stomach is empty, it already has gastric juices and hydrochloric acid ready to accept the food that you're going to give, and you add more acidity into it. Like people say, drink apple cider vinegar early in the morning. It has zero health benefits. Okay, there is no health benefits of apple cider vinegar so far. Even after these many years, researchers do not have a very conclusive statement about apple cider vinegar. So please don't indulge in such things. Do not change the pH of your stomach with vinegars or any lime water first thing in the morning. Okay. It's not about acidic or alkaline diet. Okay, if you are if you have a heavy workout kind of regime, you need protein and carbohydrate more in the diet in the morning. Okay, if you have a very sedentary lifestyle, you can focus more on protein rich diet in the morning. You can reduce your carbohydrate and fat in the morning. Okay, ideally for all the people from uh, various forms of lifestyle, lunch is the only meal where you can indulge in carbohydrate and fat rich diet. Okay, otherwise for dinner and in breakfast you can focus more on protein. Okay, high protein and low fat diets. You can definitely indulge in nuts and seeds. Okay, nuts, seeds, whole grains. Okay, first thing in the morning you can indulge in these things. Anything that adds more fiber into your diet, you can add that in the morning. Okay, anything that keeps your peristalsis, because you are encouraging your peristalsis movement early in the morning. Okay, so with fiber rich diet, your digestive system is ready to excrete as well as receive the food that you are going to give your stomach later on through your meal, snack, midday snack, dinner, etc. Okay. Quinoa is a substitute of rice usually. However, you are cooking rice, in whichever way you take rice, you can take quinoa in the same way. Please don't use combinations of fruit. Just use one fruit. See, to empty the bowel in the morning, just have lukewarm water. Okay, just have plain lukewarm water in malasana. Okay, you can Google about malasana. It's a yoga posture. Have lukewarm water in malasana. That will lead to peristaltic movement. Okay. Yeah, have only one kind of fruit at a time. Do not add too much of fruit combinations because it will conflict with each other's content.